PSI seems safe. Mechanism of injury, I have a gunshot wound. I have one patient. I am going to request additional ALS and transport. And I'm going to have one of my partners hold C-spine inline stabilization while my other patient partner cuts off the clothing and exposes my patient. Supine male, going to assess the level of responsiveness of my patient. Sir.
No response.
Going to give a trap squeeze. My patient grunts. Okay, my patient is responsive to painful stimuli. Is there any apparent life threats that I see?
There is a gunshot wound to the left pec.
Okay, so I'm going to apply direct pressure, have my partner give me an occlusive dressing, and apply the occlusive dressing, taping 3 sides down. Does it hold?
It does hold.
Okay, what I want to do is I want to assess my patient's airway with a modified jaw thrust. Do I see anything?
You do not see anything.
Okay, I want to properly size an OPA from the corner of the earlobe to the corner of the mouth. Insert it, turn 180 degrees so it sits on the lips. Does my patient accept?
Your patient does accept.
Okay, I want to get a respiratory rate and listen to lung sounds of my patient. Are they clear?
Lungs are clear.
What's the respiratory rate?
Respiratory rate is 10 and shallow.
Okay, we're going to get a BVM and ventilate our patient. 15 liters of high flow oxygen, 1 breath every 5 to 6 seconds at a rate of 10 to 12 per minute. Circulation, any bleeding going on anywhere?
No other bleeding is found.
Okay, what about pulses?
Pulse is present and it is at 110.
Pulse 110, okay. Skin color, temperature, and condition?
Warm and diaphoretic.
Okay, so my patient is exhibiting signs of shock, so what I'm going to do is have a blanket on standby. We are giving our patient oxygen therapy to treat for that. This is a high priority patient, so we're going to load and go, go through the hospital, but first, C-collar. With the help of my partner and the handman's count, what we're going to do is we're going to roll the patient in 3, 2, 1, roll him. We're going to clear the back, looking for any decap BTLS, any step-offs, exit wounds, anything that I see.
You find 1 exit wound.
Okay, so applying pressure, getting another occlusive dressing from my partner, applying it, taping 3 sides. Does it hold?
It holds.
Okay, on 3, 2, 1, handman's count, we're going to roll him back and secure him to the backboard. Is there anybody around that I can get sample history from?
No one is around.
Okay, can I get a complete set, blood pressure, respiratory rate, heart rate?
Blood pressure is 90/60, heart rate is 110, and respirations are 10 and shallow.
Okay, I want to do a complete assessment of my patient. Looking at starting at the head, decap BTLS, deformities, contusions, abrasions, punctures, penetrations, lacerations, and swelling. Do I see anything?
You do not see anything.
What about the eyes, nose, mouth, and ears? Any cerebral spinal fluid or any fluids leaking out, blood or anything?
You do not.
Okay, I'm going down to the neck. Any jugular vein distension, JVD, or tracheal deviation?
You do not.
Okay, is my check on the chest, is my occlusive dressing still holding?
It is still holding.
Okay, I'm still going to listen to breath sounds, still clear?
All clear.
Okay, I'm just going to palpate, make sure I don't see any fill segments or crepitus or anything. Do I see anything?
You do not see anything.
Okay, what about the abdomen? I'm going to start one quadrant, work my way in the other ones.
Abdomen is clear.
Abdomen's clear, soft, not tender. Okay. Come to the pelvis here. What I want to do is I want to come in and down, looking for any crepitus, deformities, anything.
You do not find anything.
Okay, while I'm here, I'm going to just ensure that there's nothing abnormal, any fluid or anything coming from the private area. Going to start on the leg, looking for any deformities, any bleeding, decap BTLS, crepitus, anything.
You do not find anything.
Okay, same on this leg here.
All clear.
Okay, pulses, pedal pulses present.
Present.
Okay, all right, I'm going to come up. One arm, same thing. Any crepitus, deformities, anything?
You do not find anything.
On this side, deformity, crepitus, or anything?
You do not find anything.
Pulses?
Pulses are present.
Okay. So I've treated my secondary intervention there with that exit wound. This is a high priority patient. I'm going to be reevaluating and reassessing my patient every 5 minutes on our way to the hospital, and we're transporting code 3.